I'm Dr. Rashmita, Assistant Professor, Department of ENT. So today's topic is DNS, that is deviated nasal septum. So coming to the anatomy of the nasal septum consists of three parts. First part is columellar septum. So columellar septum is formed by medial crura of alar cartilages united together by fibrous tissue, and it is covered on either side by the skin. Second part is your membranous septum. So it consists of double layer of skin with no bony or cartilaginous support. It lies between the columella and caudal border of the septal cartilage. So both this columellar and membranous parts are freely mobile from side to side. So you can see in the picture there's a columellar septum and a membranous septum which is pink in color, where there is no any bony or cartilaginous part, and it is only a double layered skin, and the remaining part is called as septum proper. So this septum proper is formed by osteocartilaginous framework, that is both bone as well as cartilage. It is covered with nasal mucosal membrane on both the sides. So what are the principal constituents forming this septum proper is? First is the perpendicular plate of ethmoid, second is omer, and there is a cartilage, large septal cartilage part called as quadrilateral cartilage. So coming to the etiology, what causes this DNS? So deviated nasal septum is caused by trauma. So any blow to your nose, lateral or from the front, can cause twisting of the bone or telescoping of the bone. So this might cause DNS. And during birth, during the difficulty labor, when baby is passing through a birth canal, there can be pressure over the nasal septum, which might lead to deviated nasal septum. Second cause is your developmental error. So when during development, when there is unequal growth between the palate and the base of the skull, this might lead to DNS again. And in case of mouth breathers, example adenoid hypertrophy patients, there can be high arched palate, which further leads to deviated nasal septum. And in patients with cleft lip, palate and dental abnormalities also, we can find the deviated nasal septum. Third factor is your racial factors. Here the Caucasians are more affected than Black Americans. And the fourth factor is your hereditary factor. So several members in the same family may have deviated nasal septum. So coming to the types of DNS, we have 5 types of deviated nasal septum. First is anterior dislocation. So septal cartilage may be dislocated into one of the nasal chambers. So this is better appreciated by looking at the base of the nose when patient's head is tilted back. You can see in the diagram. And second type is your C-shaped deformity. So septum is deviated in a simple curve to one side. Here the nasal chamber on the concave side of the nasal septum will be wider, which might lead to compensatory hypertrophy of your inferior turbinate. So these are all the pictures of the different types of deviated nasal septum. So first two, which I have already said, first is anterior dislocation and second type is C-shaped deflection. Next, coming to S-shaped deformity. Here it can be either in vertical plane or in anterior posterior plane. Such deformity may cause bilateral nasal obstruction. And fourth type is spur. So spur is called as shelf-like projection, often found at the junction of bony and cartilage junction. So this spur may lead to headache and repeated epistaxis. And the last type is called thickening. So this may be due to hematoma, post-trauma, because of hematoma formation or overriding of the dislocated septal fragments might lead to this thickening. Coming to the clinical features, so DNS can involve any age and any gender, but males are more affected than the females. So first clinical feature is your nasal obstruction. So on examination, we have to rule out at what level the obstruction is. Like for example, at the vestibular level or at the nasal valve level, attic or turbinal level, like in case of turbinate hypertrophy, or at choanal level in case of choanal atresia. So what test we do to rule out this nasal obstruction? So the test is called Cottle test. So in this test, we ask the patient to retract the cheek laterally while the patient breathes quietly. If the nasal airway improves on the test side, the test is positive and indicates abnormality of the vestibular component of nasal valve. So this is the picture showing the Cortels test. This is how you perform, where the patient is retracting the cheek laterally, and below picture you can see there is an improvement in the nasal airway. So second clinical feature is your headache. Why DNS is causing headache is because of the pressure. So deviated part might put pressure over the lateral wall, leading to the pressure headache. And third clinical feature is your sinusitis. So sinusitis is because when there is a DNS, it might obstruct the ostia of the sinus, which might lead to poor ventilation of the sinuses, and that further lead to sinusitis. Epistaxis, as I told you, spur causes epistaxis. So this sharp spur can stretch the blood vessels and might lead to epistaxis, or the deviated part might get exposed to the air currents and forms the crust. So in case of attempt to remove this crust might cause epistaxis. Anosmia means loss of smell sensation. So because of the nasal obstruction due to this deviated part, it prevents the air currents to or inspired air to reach the olfactory region, which leads to partial or complete loss of smell. Next feature is your external deformity. Sometimes this deviated nasal septum might cause deviation of the external part like dorsum or tip or columella. So this might lead to external deformity of the nose. And middle ear infections. So DNS might affect the function of the eustachian tube, that further leads to middle ear infection. So coming to the treatment of the deviated nasal septum, if it is a minor degree deviation, when patient has no symptoms, no treatment is required. So this is most commonly seen in maximum cases. It is most commonly minor degree of septal deviation with no symptoms. In case if there is a mechanical nasal obstruction or patient has symptoms, then we have to go for further management. So the main management will be surgical. So we have two types of surgeries, SMR and septoplasty. So SMR is called submucous resection. So what is the difference between SMR and septoplasty? So SMR, it is an extensive dissection of the septum, removing all deformed bone and cartilaginous part, preserving only a caudal and dorsal skirt of cartilage. Whereas in septoplasty, it is limited selective dissection, removing minimal cartilage and bone which provide a very good airway. So in SMR, it is not done before 17 years. Whereas in septoplasty, it can be done even in the children without affecting nasal growth. SMR, mucopericardial and periosteal flaps are raised on both the sides of the septum, whereas in septoplasty, flaps are raised only on one side and limited elevation on the opposite side. In SMR, both bony and cartilaginous parts are excised, whereas in septoplasty, only the deformed cartilage is corrected by scoring or cross-hatching or wedge excision or realigning. In SMR, there are more chances of complications. Example, supratip depression, flapping of septum. Whereas in septoplasty, there are less chances of complications. In SMR, reoperation is very difficult, whereas in septoplasty, reoperation is easier. Thank you.